Dear friends, good afternoon. Medicinal plants are regarded as esteemed therapeutic agents for the prevention of diseases and ailments in almost all parts of the world, and more so in developing nations like India. Increasing shift towards herbal medicine in modern India reflects a sustainable history of standardization that has completely changed the tradition of native medicine industry. India, with more than 80% of the world biodiversity, including plant genetic diversity with medicinal properties, holds tremendous potential in occupying global significant positions in the market for medicinal plants based herbal formulation, medicines and products. As per the estimation, the international market for herbal products are anticipated to quit a market worth of US 5 trillion by the end of the year 2050. Near about 80% contribution to the global supply of medicine plant will be handled by India and China alone. So the main focus of the current study will be critically examine India's performance in the world of medicine market. The result of the study shows us that the years of extended Indian exports in case of medicinal plant and Ayurvedic medicines is increasing day by day in comparison to 2010 with respect to 2015, 16, 17. The export has doubled. Despite India's share in global export market medicinal plants being 0.5%, the country still holds a great importance at global level and more so in the upcoming years. Recently, there has been a shift in the universal trend from the synthetic to herbal medicine, which we can say return to nature. Medicinal plants have been known for millennia and are highly esteemed all over the world as a rich source of therapeutic agents for the prevention of diseases and ailments. Nature has bestowed our country with an enormous wealth of medicinal plant. Therefore, India has often been referred as the medicinal garden of the world. Countries with ancient civilizations such as China, India, South America, Egypt, etc. are still using several plant remedies for various conditions. In this regard, India has a unique position in the world where a number of recognized indigenous systems of medicine, viz. Ayurveda, Siddha, Unani, homeopathy, yoga and naturopathy are being utilized for the health care of people. No doubt that the herbal drugs are popular among the rural and urban community of the India. The one reason for the popularity of acceptability is the belief that all natural products are safe. The demand for the plant-based medicine, health products, pharmaceuticals, food nutrient, supplement and cosmetics, etc. are increasing both developing and developed countries due to the growing recognition of the natural products which are non-toxic, have less side effects and easily available at affordable prices. The export of medicinal plant and herbs from India has been quite substantial for the last few years. India has a large endemic flora. There are more than 80,000 medicinal plants known and nearly 180 plant-derived chemical compounds have been developed as modern pharmaceutical which include in the pharmacopoeia of India. The domestic Ayurvedic market is estimated to be 1 billion and is growing at the rate of 15 to 20% annually. India has been a major supplier of medicinal plant in the market until 1977 when it was kept to second position by South Korea with export worth only rupees 16 crore during the 1978 to 79. The quantum of export had dropped to almost half of the what it was in 76 to 77 when India exported medicinal plant worth around rupees 29.8 crore. The items of export value were opium, siltium, husk and seeds and vinca rosea, cut roots and senna leaves and pods. The annual turnover was around US $300 million. In 1995, Psyllium, husk, seeds, and simmer are the main export items from India. During 1998-99, India exported psyllium husk worth rupees $19.6 million and senna leaves worth rupees $22.4. India also exported Finnish Ayurvedic and Unani medicine during the year 2000 to 2001. It exported medicine worth around $128 million to various countries like United States, Germany, Russia, UK, Hong Kong, and Malaysia. The global herbal industry is estimated to be $50 billion annually and growing at the rate of 7 to 8% annually. The Indian contribution to the global industry is around 10% only. One of the important items of export covering approximately 80% of the world requirement is proteolytic enzyme, papain, mainly manufactured in Maharashtra from the raw papaya fruits, and the commercial production of the pectin from the thalamus of sunflower is also carried out Jalgaon in Maharashtra. India is one of the few countries in the world where essential oil industry is developed at a very early stage. The essential oil, perfume, flares have been associated with the Indian civilization for several thousand years because of its vast area and variety of soil and climatic condition. Essential oils containing plants of all types can be grown in one and other parts of the country. India produces essential oils from wild and commercially grown plants in appreciable quantities such as palmaris, citronella, and calamus, cardamom, etc. Cedarwood, dill, ginger, lemongrass, vetiver, and rose oil. The annual production of coriander is about 243,000 tons, which constitute approximately 80% of the world demand. About 30% of global demand in cardamom and 15% of saffron are made by India. The annual production of saffron is approximately 200 tons. The most significant export of the sandalwood oil, for which our country is the major producer, exporting approximately 50 to 60 tons to the world market. India is a leader in the production of menthol, as mentha oil steadily expanded in the last decade. During the year 2000 to 2001, India exported about 3,870 tons of mint oil worth about rupees 1.26 billion. India is also a leader in production and export of high-value perfumes for the world market. The domestic market of Indian traditional system of medicine comprising of Ayurveda, Unani, Siddha, homeopathy has been reported to the tune of approximately rupees 50,000 crores and rupees 550 crores annually. In the domestic market, the Ayurvedic medicine account for the major portion, about 85% of compared to Unani, Siddha, homeopathy system. The total patent and proprietary medicine of this system are manufactured over 9,500 licensed pharmacies and herbal manufacturing units spread all over India. With the development of the phytochemical industry in India, domestic requirement for the various medicinal plants grew considerably. Consequently, the government of India has adopted restrictive export policy in respect to those crude drugs which were indiscriminately exploited in the forests, such as Rauwolfia, Podophyllum, Indian rhubarb, etc. among the main medicinal plant. However, with due permission of the chief conservator of forest officer authorized by him, the material of plantation or of the nursery origin certificate can be exported. These medicines are mainly consumed within the country, and some of these are also exported to the Middle East. Major destination countries are United Nations, United States, Nepal, Japan, Sri Lanka, Russia, Germany, Italy, Nigeria, and United Arab Emirates. And according to the survey report, Sri Lanka, Egypt, Bangladesh and Mauritius are the countries having maximum export potential. The major pharmaceutical exported from India in recent years were isabgol, vinca extract, senna leaves and castor oil in dehydrated form, beta-alanine, papain, berberine and hydrochloride and opium alkaloids. India's export of essential oil during the few years has shown an erratic trend. The sandalwood oil share is more than 50% in the total export. The United States accounted for major share of export of this item, followed by USSR. The mentha oil has the same export turned as the cheaper quality is being exported by the China. India is also exporting volatile oils to France, Japan, Sudan, Germany and Switzerland. The other important items of export value are cardamom oil, lemongrass oil, palmosora oil, pudina oil and peppermint oil, clove oil, geranium oil and vetiver oil and lavender oil. The export of herbs and value-added extract of medicinal herbs are gradually increasing over the years. India exported USD 330 million worth of herbs during 2017 and 18 with a growth rate of 14% over the previous year. Also, the export of value-added extract of medicinal herbs and herbal produce during 2017-18 stood at USD 456 million, recording a growth of 12.23% over the previous year. Now, I am coming to few challenges of exporting herbs and medicinal plants across the globe. The total world herbal trade is currently assessed at USD 120 billion. India's share in the global export of herbs and herbal products is low due to the following reason. We have the following challenges. Number one, inadequate agriculture practices. We know that medicinal plant is important and we can sell the medicinal plant at a higher rate in the international market, but our farmers are not aware how to cultivate a large amount of medicinal plant as agricultural practices. Number two, inadequate quality control of produced. When we produce some medicinal plant, we don't check the quality control during the production of the medicinal plant or during the output of medicinal plant. Number three, challenges. Lack of large-scale organic cultivation. You know, in the world market or international market, the demand or need of organic agro-based product is increasing day by day. A large number of developed countries citizens, those who are very conscious about their body and health, they only choose organic produce, and that too certified organic produce. Number third challenge is lack of large scale industry connected with the herbal and medicinal plant. Number four challenge is lack of processing and research and development facilities. Number fifth challenge, lack of standardization in product, process and services. Number six challenge, lack of regulatory framework in the trade of medicinal plants. In order to India's exports and to promote the medicinal plant across the international market, Government of India and its different department is taking a coordinated different measures to increase the export volume. Number one, Department of Commerce has set up export promotion councils for promoting exports of various products and groups. The mandate of export promotion of herbs and medicinal plant has been assigned to Silk and Forest Products Export Promotion Council, that is CEPECSIL, headquartered at Kolkata. The Export Promotion Council of several herbal products has been assigned to Pharmaceutical Export Promotion Council, that is PharmExCil, besides other. This EPC facilitates the exporting community and undertake various promotional measures for the promotion of export to their products. Under the Market Access Initiative, that is called MAI scheme of the Department of Commerce, the EPC or trade bodies are provided financial assistance for participation and organizing trade fairs, buyer-seller meet, reverse buyer-seller meets, research and product development, market studies, etc. Merchandise export from India scheme, that is MEIS, provides incentive to the exporting community for specified goods so as to offset infrastructural inefficiencies and the associated cost of exporting product produced in India, giving a special emphasis to those who are in India's export interest and have the capabilities to generate employment and enhance India's competitiveness in the world market. Nirjat Bondhu scheme has been galvanized and repositioned to achieve the objective of Skill India and trade promotion and awareness. International Cooperation Scheme of Ayush Ministry provides financial assistance to the exporters for the participation in trade fair, organizing international business meets, conference and product registration and reimbursement. The National Medicinal Plant Board, that is NMPB, Ministry of Ayush, Government of India has launched a voluntary certificate scheme for medicinal plants produce, that is VCS MPP, on 22nd November 2017 in order to encourage the good agricultural practices or GAPs and good field collection practices or GFCP in medicinal plant. The VCS MPP will enhance the availability of the certified quality medicinal plant raw material in the country and also boost the export and increase the India's share in the global export of herbs. Ministry of Ayush, through its quality certificate program like Ayush Mark and Premium Mark, is also assisting industry in setting up the quality standards. Ministry of Ayush has entered into memorandum of understanding with few countries for the promotion of traditional medicine, which will help exports in long run. Apart from this, if we coordinate with different countries' research center and our country's research center for the medicinal plant research and production of herbal medicine at low cost and affordable prices, it will be a great benefit for the citizen of both the country. Apart from this, different chamber of commerce across the India, across the globe can exchange seminar, views and interaction with the buyer-seller made in a befitting manner so that the Chamber of Commerce can facilitate the exporters or medicinal plant producing organizations. Thank you all the best. Myself Unus Molla, CEO, International Business Center and Export Promotion Council Network, which is a network of 11,400 export company and export organization around the globe. All the best. Thank you.